I want to begin by showing a short video, and then we'll take it from there. Every time I watch this, I tear up. Why? Because it's real. And I've seen it. I saw it just a week ago. I saw this lady who doesn't completely understand, but it was a gentleman. It was a 69-year-old gentleman who walked through that door in the morning oncology clinic. And I was sitting there like a diligent medical student, holding my iPad in a little corner, taking my notes. And the doctor's sitting behind a desk. Patient sits down. Doctor takes a deep breath and breaks the bad news. The cancer has spread to your liver and to your lungs. There's no cure. You don't have a lot of time left. But we can do chemotherapy. And, with chemotherapy comes some side effects, nausea, vomiting, hair loss, and, fatigue as well. And also we're going to do a PICC line right here in your arm, which you're going to have to wash every day, and just be careful water doesn't go on it because it can get infected. Oh yeah, and just measure your temperature every morning, because if your temperature goes above a certain degree, then we're kind of worried, so you have to come in. And yeah, just here, you can sign this form just to start chemotherapy from next week. I was mortified. I was looking at the patient's face. He was shell-shocked. From the moment the doctor said, cancer, there's no cure, everything went over his head. He didn't hear anything. I wanted to stand up and go, stop! Can't you see his face? But I didn't. I guess it wasn't my place. I wasn't used to this. I grew up in an island, divided island in the Mediterranean in Cyprus. I grew up in quite a big family of 7. I went to London to get my degree. I'm a UCL medical student, 5th year. With me here, I have my sister, Sofronia. She's a medical student in Queen Mary in London. And then I have my other sister, Grigoria. She's an occupational therapist student. So we brought the whole family. The first question that should come to your mind is, why did you all go into healthcare? Is in there other fields? Well, it's because of this guy right here. This is my father. Just imagine him without hair. I grew up going back to having my little backpack, going back home, and then at the front door, there would be crates of fresh vegetables and jams and bread, sometimes with a little note, sometimes not. My dad, a simple family practitioner, never really accepted gifts. So patients would just come and leave the stuff at the front door. I thought that was normal. Once a guy brought a whole goat. My mom wasn't really happy. But the truth is, I found out later why this was happening. When I went and saw my dad and what he was doing. He was in his office, the desk on the wall. He was sitting next to the patient. He was actively listening. He wasn't typing on his computer or anything. And he could understand the patient's pain. He knew from the simplest pain that their football team lost their match yesterday, how to talk to the patient, to the most complex one. When the woman comes in and her son is neck deep in drug abuse, he knew how to talk to her. And he helped. He helped. He made a difference. You know why? Because he treated the patient, not just their symptoms. It's a big difference. Just like my father, there's so many people around this world who do the same thing and understand the value of compassion. And that's why they came together and they formed the International Institute of Compassionate Care, an institute at a time where the world is in a crisis. We just came out of the pandemic crisis, where we've entered a new crisis, the mental health care crisis, especially in teenagers my age. I've seen this as well. In a world where there's war raging almost in every corner of the world right now, we've got it in Ukraine, now we've got it in Gaza. At a time where healthcare support is needed the most, it's in shambles. We got doctors striking, nurses striking, they're overworked, they're underpaid. And this is not only in the UK, this is everywhere in the world. Healthcare systems are a ticking time bomb. Just in the US, there's 500,000 practitioners who have gone through burnout, which increases twice the risk for patient safety incidents. And guess how much the US has paid in order to replace these doctors? In 1 year, 12 billion. That's crazy, isn't it? And what about the patients? They're the focus, right? Well, they're dissatisfied as well. And guess what? They've lost their trust in the healthcare profession. I don't blame them. Only in the UK, they wait 4 hours until they get a doctor to see them in the A&D. Some of them are waiting a year for a knee replacement. Now, the answer to this isn't simple. It's not going to be fast and it's not going to be easy. But we know that one thing can help. We know that compassion can help. And it can help quite a lot. When I'm defining compassion, I love the definition of a child. When my friend gets hurt, I go and I look after them and I make funny faces to make them feel better. So what's happening here? There's 2 things. One is the child is understanding the pain of the other person. So I know they're hurt. I know they're suffering. And the second is the action and the willingness to go and help and make the funny faces, make him laugh, look after them. This is what I grew up seeing. But I think the best person to hear from what compassion really is a patient. So let's hear the story of a patient.
I woke up in intensive care. My eyes were swollen shut, I couldn't see. My jaw was wired closed, and there was a hole in my throat, so I couldn't eat, I couldn't speak, I couldn't drink. And there was a machine forcing air through the hole in my throat, so I couldn't even breathe for myself. But I could hear everything. And I searched through all the noises of a busy intensive care unit for any sign about what was happening or likely to happen to me. And then a machine would beep loudly. I couldn't see, and I didn't know what it was. And I thought that maybe I was going to die. But somebody would come and they would reset the alarm and move away silently. And the doctors would come around the bed and they would discuss my case in great detail with each other in a language that I didn't understand. And then they too would just quietly go away. And at night, nurses would come and they would attend to the IV lines that fed and hydrated and medicated me, and they would take notes, I suppose, and read things. And they attended to my physical needs with skilled efficiency, but they never saw, they never acknowledged my emotional wounds, except for one special nurse. Every time he came in to look after me, he would lean close to my face and put his hand on my shoulder. And I could see through the slits in my eyes the outline of him, and he would call me by name. And then he would tell me what he was going to be doing that day. And then he did something that not one other person did for the 3 weeks that I was on life support. He talked to me like a human being. He would talk about everyday things as he went about cleaning my wounds, cleaning my body, washing me, changing my clothes, checking my IV lines. He would talk about things like what kind of a day it was outside, or who would come to visit me while I was asleep. He talked about common everyday things. And it didn't take him a moment longer than it might have taken otherwise. People are so afraid that if you make a human connection with the patient, that it's going to take too much time. It took him no extra time. And yet, 20 years later, it was 20 years ago that I had a multi-trauma accident that nearly killed me and kept me in hospitals for 17 years. But I remember him, and every time I speak, I tell the story of this nurse, this wonderful man, and how much his touch that didn't hurt, that wasn't efficient, how much that meant to me, how much telling me what the weather was like outside, or telling me a little anecdote about something that was on the news, anything like that reminded me that I was more than a broken body. And I will never forget him.
I was going to read another story, but in the interest of time, I will leave it. And I will tell you, I will try to summarize it. The story is, "Please, doctor, let me die." And it's about avoiding futile over-treatment in patients. And the reason why I presented these two stories is to show the simple fact that compassion can be actions and inactions. And the beauty of it lies in the discernment which to take. To take the action or to take the inaction, or to just stand back and give the patient peace. But this is just scratching the surface. Compassion is much more than that, and there's so much evidence behind it. It's not just me here saying how nice and beautiful it is to be a human. And a great example to bring up now would be Sir David Haslam. He's a member of the International Institute of Compassionate Care. He was the president of all these organizations here, but I want to focus on one of them. The NICE, National Institute for Health and Care Excellence. So this institute decides what treatments and what drugs are good, and they're cost effective, and they can be used in hospitals all over the UK. He would go around, he says this story very beautifully, I'm going to try and imitate him. He would go around the UK and talk about evidence-based medicine. And he would talk about compassion and kindness. And people would come up to me after the lecture, and they'd be like, well, it's pretty surprising that you talked about compassion, about kindness. And his answer would always be, why? This is evidence-based. Like, This matters. This makes a change. We have, it's solid. This is not the soft and cuddly side of medicine. And it works on so many levels. It works on the patient's level. Okay? So it can accelerate recovery. It can improve pain tolerance. It can improve anxiety and depression. And guess what? When patients were asked what is the most important factor in the treatment, what did they say? Compassion. Funny, huh? What about healthcare professionals? It can decrease burnout. It can decrease costs for organizations. It can increase job satisfaction. And it can increase customer satisfaction. You want to know the best thing out of all? It's free. It costs nothing and no time. Crazy, huh? So seeing this at the International Institute, we decided to write a book about it. And we released it with Springer. The book is called The Art and Science of Compassionate Care, and it's a practical guide. It bridges the gap between the theory of compassion and the practice of compassion. And it's practical. And it's written by a multidisciplinary team, from nurses to medical students to doctors to psychologists to healthcare managers to economists. It's all there. And guess what? I'm going to say it once more because I think it's so important. It's evidence-based. We know it works. In the book, we talk about a lot of things, but one of the important aspects that I want to focus on today is, can we teach compassion? Of you here today, who thinks we can teach compassion? Put your hand up. I like the optimism. Let's convince the rest of the people. Hopefully some of you recognize this. This is Aristotle, the great teacher of Alexander the Great, and then Plato next to him in the Platonic Academy, arguably the first university of the world. And back then, thousands of years ago, questions such as, can we teach virtues, they were on their minds. And this is what Aristotle had to say about it. Educating the mind without educating the heart is no education at all. So they believed that you could educate the heart. They believed that you could cultivate virtues. More recent philosophers agree. And the science confirms it. Now, I'm going to do a little experiment now. Make you envision and try and show you how this works. I want you to think of your best friend. And think of a time where you spend quite a lot of time with them. And then after that time, you start acting a bit, maybe doing something that's not in accordance with your character. And then you catch yourself and you're like, wait a second, why did I say that? It's because I was hanging out with so-and-so. This is the power of environment. And this is the power of spending time with people around us. If your friend was compassionate, kind, a better listener than you would have shown those virtues. But what happens if it's the opposite? Well, in universities, in healthcare universities, I've experienced it. You become less compassionate. You become less bothered about these kind of virtues. You become more bothered about the tasks, about all the bullet points that you have to get through, about all the tick boxes that you have to tick. And what happens? The following phenomenon happens. The phenomenon of the hardening of the heart. And this is actually pretty well documented, which shows that if the environment that we're in, and this is in hospitals as well, is not recognizing, is not highlighting, and it's not rewarding virtuous behavior, such as compassionate behavior, then we get the opposite effect. And we get results such as this. Who remembers the Francis report from a Stanford hospital in the UK? This was a report on the failings of a hospital where the institution, and then the doctors as well, everything starts at the top of pyramids, had some tasks that they had some goals. We have to get these goals. And they forgot about the patient care. So what happens? Patient care went to shambles. There's incidences where patients were drinking from plants water because they were so dehydrated and they wanted to drink something, and no one was bringing them anything. It's shocking. And you remember before we talked about the most important factor that they ranked it? There's been studies that show that doctors rank scientific skill as one of the most important factors. I'm not saying we should put it down. I'm saying they should both be equally important. In this hospital, the report that came after suggested that we measure compassion. It's pretty weird. Can you measure compassion? Can you actually measure a virtue? The truth is, we can. And there are questionnaires that are validated in order to do, such as the Sinclair Compassion Questionnaire, and many out there as well. We talk about a lot more in the book, but I wanted to mention one more, just because we're at the Arts and Medicine conference. Art, poetry, and literature, if they're embedded in education, they can help visualize, this is so important, and understand the pain of another human being. That's step number one. And then we create the willingness. So, C.S. Lewis used to say, education without virtue seems rather to make a man a more clever devil. So that's why we need to accompany all the skills that we're teaching in universities, self-reflection, active listening, advanced intercultural communication, with empathy, trust, honesty, humility, love, and gratitude. All these tables are in the book, and you can find many more. Such as many more techniques that can be used, such as the Swartz rounds, narrative medicine, etc. Where do we start? We start as early as possible. We start from universities, and I'd say even before universities. We make it something that students aim to show at their interviews. Why? Will Durant used to say, we are what we repeatedly do. Therefore, excellence is not an act, but a habit. I'm going to change this up a bit. Compassion is not an act, but a habit. So we need to start early. We need to repeat it over a period of time. And I'm going to finish on this. I'm going to introduce the 3C model. After the distillment of the literature, we came up with this. We need to cultivate it. We start early, the techniques that we've shown. We check it with the test that we've shown. And then we conserve it from the start to the end. From the point someone has the idea they want to be a medical student, they want to be a doctor, they want to be a nurse, they want to be a physio, to the end where they're retired. Again, more details can be found in the book. But I want to end on this. So this is a call for action. Next time you're in a hospital, next time you're next to a patient, ask them if they need an extra blanket. Make sure that their cup of water is close to them, and maybe straighten their pillow. Because it's a ripple. It's a ripple in the ocean that can make a big difference. And if you see someone doing these things, I urge you, say the following. I saw what you did. You made the world a better place. Thank you.